Scanning the room.
Hello, my name is Sarah New, and I am a first-year nursing student at Williston State College. Today I am going to be demonstrating some position changes for the patient, some passive range of motion exercises, transferring the patient from the bed to the chair, ambulating, and then applying an anti-embolism hose to the foot. So I have entered the room, introduced myself to the patient, performed hand hygiene, provided privacy, identified that is the correct patient. I will assess whether or not the patient is in any pain or nauseous. If they were, I would want to medicate them and then come back in 30 minutes. Also, I checked the chart for any contraindications for position changes or activity levels. I have made sure that the bed is locked and that it was in the lowest position when I came in the room. All right, so now we're gonna go ahead and raise the bed to waist level. We do this so that we have proper mechanics so that we don't hurt our backs while we're working with the patient. All right, so first we're going to exercise the shoulder. And I only want to expose the arm that I'm working with. All right. The arm is in the prone position. I'm going to put one hand above the elbow, one hand below the elbow. And we're going to lift up until the inner elbow is lined up with the patient's ear or until we feel resistance. And we would stop at that point, returning back to the side and repeating that exercise 5 to 10 times. All right. And the next position would be to go from abducting to adducting. And to do that, we want to bring the shoulder out to a 90-degree angle and returning back to the side of the bed, to the side of the body, repeating that 5 to 10 times. And now we're going to do internal and external rotation. So we're just going to hold the elbow slightly bent and bring it up till the hand touches the opposite shoulder. Again, repeating that 5 to 10 times and returning back at resting position. Okay, now we're going to go ahead and exercise the hip and the knee. Just going to expose that. So I'm going to place one hand on the calf just slightly below the knee and one hand on the heel. I'm going to bring the hip and the knee up, keeping the lower leg parallel to the bed. Repeating that exercise 5 to 10 times. And now we're going to abduct and adduct. I want to switch positions of the hand, putting one below the knee and one on the lower leg, making sure that the thigh, the knee, and the lower leg are straight so that we do not damage any of the joints, particularly the ACL and the knee. So we're going to extend outward as far as that is comfortable for the patient, returning to midline, and then crossing over midline slightly. We would not do that. We would not cross over the midline if the patient were a post-op hip operation patient. All right, so repeating that 5 to 10 times. Now we want to maintain our hand positions, and we're going to do an internal rotation of the hip by rolling the leg inward until the big toe touches the bed, repeating that 5 to 10 times. And then we're going to do external rotation, same hand positions, rolling the leg until the little toe touches the bed, repeating that 5 to 10 times. Okay, so we're done with our exercises. And now I need to move my patient back up into bed, so I'm going to need some assistance. All right, first I want to place the pillow on the headboard. This will protect the patient's head when we slide it. Our patient is conscious, so she's going to help us by flexing her knees and placing her feet flat on the bed. And also by flexing her neck to her chin. This will create a smaller surface area, creating less friction so that it's easier to slide them up in bed. Okay, so I have instructed the patient that on the count of 3, she's going to push down on the bed to help us move her up. And I've also let my assistant know that on 3, we're going to shift our weight from our back foot, which is facing the bed, to our front foot, which is facing the head of the bed. All right, so 1, 2, 3. Perfect. Okay, so we're just gonna put that pillow back under their head. All right, so this patient needs to be moved every 2 hours. So we're gonna go ahead and move her into a lateral sideline position. All right, so let's just fan fold these down, get those out of our way. All right, and I wanna pull her towards me just a little bit. So on 3, 1, 2, 3, perfect. Okay, so I want this arm to kind of rest over the body. I'm going to bend the knees and place a pillow between the knees. Okay, and I'll have my assistant hold the draw sheet at the shoulder and slightly below the hip. On 3, we're going to lift. 1, 2, 3. We'll grab a pillow and we want to place it from the shoulder to the hip. And go ahead and relax. And we're going to put a pillow right under that forearm. And at this time, we would raise the bed rails, switch positions, and I would walk around and move the shoulder slightly forward just to get that pressure off the neck and the shoulder and make the client a little more comfortable. All right, so they're in a good position. Normally, I would get them covered and leave them for a couple hours before I come back. All right, so now we need to go back to supine. So again, with the draw sheet, I'm going to fold it up. And my assistant hold that on 3, 1, 2, 3. Remove the pillow. Go ahead and come on down. This one out of here. I'm going to put this under the forearm, not too high, and that just kind of adds additional comfort and support. And then we want to add a pillow under the knees. Thank you. This helps support the lower back. If my patient were unconscious, we would want to add another pillow here, making sure to float the heels to avoid any more pressure injuries. Let's put this under there. Okay. All right, at this time, I would want to get a blood pressure so that we can compare it when we sit her up in a minute for any orthostatic hypotension. All right, so we're going to go ahead and move into the Fowler's position. Raise these. I'm going to do a full Fowler's and also raise the foot of the bed slightly so that the client doesn't slide down in the bed. All right. So at this time, I would be preparing my client to dangle. So they are conscious, so I would just have them put the gait belt on while they're sitting in bed. They would grab onto my elbows, and on 3, I would hold on to either side of the gait belt, pull them towards me as they swung their legs around as they're dangling. I want to get another blood pressure and compare it to the previous one so that we could check for any orthostatic hypotension issues before we get them up out of the bed. Okay, and also while they're dangling, I'm going to put on a robe so that they stay warm and it helps cover their back, and put on some skid socks. All right. So now we're going to switch from the dummy to my live assistant. Just going to scoot her over a little bit. Now normally as they're sitting there, I would just raise the bed down before I took the blood pressure, but makes it easier for my assistant to get in bed this way. All right, go ahead and have a seat. We got our robe on, we got our socks on. Make sure my client is feeling okay, no pain, no nausea, not dizzy. We're going to apply the gait belt. It's going to go around the waist. And you want it snug but not too tight. You check that by putting 3 fingers in between. It is perfect. All right, so that can go any lower. No,
Mm,
I can't.
sorry.
So our patient's little, but yeah, just go for it. There we go. So we want to be toe to toe, knee to knee. You're gonna hold the back of my arms. I'm gonna hold each side of the gait belt. And on 3, we're gonna stand big and tall. 1, 2, 3. Perfect. Now we're going to pivot over to the chair. She wants to back up until her knees touch the chair. Reach back, grab the arms, and ease yourself down. Now I would go to the side, just make sure her back is aligned and that her hips are all the way back. Now we're going to ambulate. So again, with the same body mechanics, we're gonna go toe to toe, knee to knee, on 3. 1, 2, 3. All right, I will position myself behind and to the side, and we will walk just around the room a little bit, taking our time, going with the flow with the patient. All right, so now we're gonna return to the bed, help them back in the bed. Remove the robe. They can keep their skin socks on. Nope, we're gonna take those off because we're gonna put on anti-embolism hose. All right, just help them back in the bed, make sure they're comfortable. Okay, so we have checked the orders for which hose we need to put on, and they're gonna be knee highs. Before we put those on, we wanna measure from the heel to 1 inch below the knee and at the widest part of the calf. Okay, so I would get the proper size according to those measurements. And these are thigh highs, but we're just gonna use them as knee highs for the video. Okay, so I wanna find the heel. I'm gonna reach in. Pinch the heel. Hold on. We're gonna reach in, pinch that heel. All right, so you just wanna hold it there, straighten it out over your arm, and then pull down, expose slightly. Now still pinching that heel so I know where it's at. I'm gonna come over here, place it on the foot, upside down. All right, and just gently smooth it over the leg, 1 inch below that knee. Check in for any wrinkles. It's nice and smooth. And we are open at the bottom. You don't want to leave it all exposed like this because it'll get cold. So you just flip it over. Now the reason it's open is so that we may check for any capillary refill. Now you want to remove these at least twice a day. Don't want to leave them on all day, usually in the morning and at bedtime. And that's it. Okay, so before I leave, I'm going to make sure my client is comfortable, not in any pain or nauseous, and that they're good to go, and I'm going to perform hand hygiene and leave the room.